I'm David Mason, the Director of Public Health, and today we have Public Service Announcement number 16. With us today we have Dr. Pamela Snyder, who is a member of the Sandwich Board of Health. And we will, just a couple of quick things. The Council on Aging staff is distributed hot meals to seniors last evening, thanks to Amari Restaurant. And the Cape Cod Family Table Collaborative will be back on Tuesday, May 19th, providing hot meals to the community from 4 to 6 at Sandwich High School. And we have the Fund for Sandwich, the www.fundforsandwich.org, for their COVID response fund for Council on Aging, Cape Kids Meals, and it's benefiting sandwich organizations. And as we usually do, we'll start with Chief Burke as far as an update on the COVID situation.
Good morning, Dave. Thank you. As of today, May 7th, 4 positive cases, 59 recoveries, no hospitalizations, and the 2 deaths. So we are definitely going in the right direction in terms of numbers, which is good to see.
So we're going in the right direction with regards to the COVID and cases, and people are following the protocols, being considerate and smart. But one of the issues why we're here to speak today, and why we have Dr. Snyder here today, is because of an issue that Chief Burke is seeing in his responses for emergency calls. And why don't you tell us about that?
Yeah, so the level of calls have decreased by about 10%, but the criticality that we're seeing is much more prevalent than in the past. And one of the things that stood out in our analysis was we average about a dozen cardiac arrests a year out of healthcare facilities, so that's home-based. That's our average for the year. In the last 5.5 to 6 weeks, we've done 8. And that is concerning. Again, this is a non-healthcare facility cardiac arrest. These are people at home. And the trend started, and we started to look at it, and the concern level started to raise. And it's not necessarily COVID disease related, but I think Dr. Snyder is going to hit on this also. It may be an aversion to the hospitals for fear of contracting COVID, where people are putting symptoms off. So again, it's been an interesting trend. We had 2 last week, so we are tracking that closely, and I'm glad to have Dr. Snyder here today to be able to speak from a physician's point of view, letting our residents know that you do need to seek appropriate health care when the symptoms arise.
So we are aware that heart attack symptoms are associated with COVID, but at the same time, the cases that you're seeing, because we do get people tested, but at the same time, that what you're seeing isn't related. We haven't seen that relationship yet. That's
correct. And again, you look at, there's a couple of factors there: sedentary lifestyle due to the the requirement to stay home, and again, the key element, I think, here is the aversion to seek health care, and the fear factor that is out there that I think we need to dispel. And I think Dr. Snyder will speak eloquently to that here shortly, to let people know if you need us, you need to call us, and we don't want to have a situation where people wait.
Right, so this is the next challenge we're having, and that's why we brought in Dr. Snyder to help us understand that, to help you understand that, and what is occurring out there as far as people's needs to receive medical attention. And as far as Dr. Snyder, are patients afraid to go to the physician right now?
So the bottom line is yes. I think people have concerns. They're concerned about going to their primary cares. They're concerned about going to the emergency room. In truth, a lot of primary care physicians are not seeing people in their office. They're doing telehealth. However, the telehealth is very active and effective if you do not have acute concerning symptoms. So we want to divide people into 2 groups. We want to divide people who have chronic conditions who may be ramping up to exacerbation that can be preempted by their primary care. Those patients should contact their primary care and use the telehealth system. The expansion of coverage of telehealth by the insurance companies has been extremely effective. People should not be afraid to contact their doctors. Their doctors want to hear from them. Many times an adjustment of medication, discussing lifestyle, discussing how they're managing at home could in fact preempt an acute event. The folks that are best known by their primary cares should access that care and use them as a strong and consistent resource. An acute event is described as something that is out of the ordinary for a patient. So acute events should be evaluated in an emergency situation. This morning I spoke to the administrator at Cape Cod Healthcare, Dr. Kevin Mulroy, and he basically wants people to take care of any acute symptom, and we'll go over that, as they would in a non-COVID situation. They do not want to see people delaying pursuing health care for acute symptoms such that they turn something into a manageable and correctable event into something that causes the patient permanent harm. So an example for that would be chest pain. There are a lot of people who have chronic chest pain. They have some angina. It's managed well by their medication, but maybe they're experiencing an uptick due to the stress and inactivity associated with COVID. They should contact their primary care. They should do so during the day hours so that they're not reaching an answering service at night and escalating a manageable problem. Folks who experience crushing chest pain, pressure, acute shortness of breath, pain that doesn't remediate with their medication should call 911. They should not wait an hour or 2 hours or 5 minutes. They should call 911. The emergency room is set up for these patients. They're treating everybody as if they have COVID, no matter what the diagnosis is. The potential for exposure in the emergency room is literally as close to zero as they can make it. Any patient who walks in, i.e. not coming in via ambulance, is being screened before they even can walk through the door. All standard precautions are being taken with masks, gloves. There's very adequate PPE, which is the protective equipment. They have no shortage of beds, nurses, ICU beds. The cardiac cath lab is functional and waiting for anybody who needs it. They do not want people to sit at home. The fear is that these folks who have angina are sustaining cardiac pathologies, such as irrevocable scarring of the heart muscle, which will lead to permanent limitation in their function. Those things can be attended to by the cardiologist in an acute setting so that they don't have irrevocable harm to their hearts later on. The concern is they're going to see a tremendous number of folks come in several weeks who have sustained events at home trying to ride it out because they're concerned about going to the emergency room, who will have things that cannot be fixed. So they urge people to come in if they have unrelenting chest pain. They urge people to come in if they have stroke symptoms. We all know what those are, but acute weakness of the face, acute weakness of an arm, extremities, acute slurring of speech, acute change in vision, dizziness, all should be contacting 911 immediately. The faster you get in, the better your odds are of a complete and effective reversal of those symptoms. So we understand people's concerns about accessing health care. What we're trying to do is encourage people who have symptoms of significant concern, as I've outlined, to utilize their resources appropriately. So 911 is there for you, but we don't want folks waiting all day long, calling 911 at 3 o'clock in the morning with basically an acute event that reduces their potential for reversal of heart damage or even potentially threatens their lives.
So your discussions at this point have been that the emergency room, they're required precautions to protect these people. So what people typically see in the news, and I'll use New York City as the example, where you had that level of patients and the concern that existed in there because of a lot of COVID patients. We have COVID patients, but we're not seeing to that extent, and the precautions they're taking are to protect everyone.
Exactly. The emergency rooms, fortunately, because people have been compliant, and we congratulate people for that. However, we don't want compliance to be misconstrued with the idea that you shouldn't seek care when you have an emergency situation, and that's, I think, what we're seeing. The emergency room on the Cape and many of the emergency rooms throughout Massachusetts are in very good shape. The hospitals are in very good shape. There's tremendous resources. They've done a very good job. They're well prepared. In the entire hospital, every patient is treated until testing proves one way or another as if they have COVID. So therefore, when you go in there, you're in an environment that's extremely safe. Everybody is following the same precautions. Everybody is socially distancing, and if they can't, they're wearing full protective gear. So folks who need to be in that emergency room, folks who need to be in the hospital are very safe. And much safer than if they stay home with a very concerning symptom and try to address it themselves.
Can you tell us about the telehealth? You mentioned that term, and a lot of people may not be familiar with that.
What term?
Telehealth?
Telehealth, okay.
If you can just talk to that.
Sure.
And what the options are. I'm assuming, I know there's people, video Zooming with their doctors, and they're having that type of experience. And if they're not able to do that, a call suffices at that.
That's right. So there are two ways to communicate with your physician via telehealth. One is utilizing one of these face-to-face type things, these virtual interactions via Google, Zoom, iPads, all of that. Physicians who know their patients can often identify things that are going on when they see their patient because they're very familiar with them. So even if you're not in person with your physician, they can watch your breathing. They can detect whether you're having difficulty sustaining speech without becoming short of breath, which is a very significant symptom. They can look at the facial features. They can see the coloring. They can talk to people. That is an incredibly effective way for your physician to screen if you're getting into trouble, and all of the physician offices have that capacity. If the patient doesn't have the capacity to do a virtual face-to-face kind of thing via use of iPad, computer, iPhone, they can call in and discuss it. So the doctors will call you back, have a virtual visit via telephone or on the computer, and be able to guide folks appropriately.
So there are physicians seeing patients at their offices in some cases?
They're not. I can't speak to all of the offices. Some of the offices are only doing virtual care. In my personal situation, we are seeing people who have acute symptoms that are not COVID. And the patients that we're seeing are screened. They have their temperature screened. They have a mask put on. They're escorted to the office, literally. We see them, and they're escorted back out so they can't wander around. I can't speak to all offices, but we've instituted that, and that's worked very well.
So they should check with their own.
Should check with their
care
personal.
physician.
I would also encourage people who have significant chronic conditions, who have not touched base with their practitioners for a while, who are feeling stressed, who are maybe noticing that their blood sugar control is poor, that their blood sugars are high, that they're having difficulty controlling it, or they're taking more medication, or they're noticing more edema in their legs, or they're more short of breath, or their medicines aren't as effective. I would encourage them, even if they don't have any planned contact, to call in and say to their doctor, I'm feeling very stressed. My blood sugars are running in the 300s. I notice my medicine's not working well. Can we invoke a plan of action? What should I do if? How should I adjust my medication? When should I call you again? When should I go to the emergency room? What are my symptoms that I should be concerned about? I think that if we're proactive and we, that ounce of prevention, pound of cure thing, I really think that people who have these chronic conditions should not be afraid to call their doctors. A lot of elderly feel like they're bothering their doctors. They feel afraid, ashamed, embarrassed, or they just don't want to be, they don't want to cause any trouble. They don't want to be a pain. They literally feel like they're causing their doctors trouble if they call. That is 100% not true. It's the complete opposite. The physicians would like them to call in and talk to them well before they get into trouble. We are seeing a lot of elderly folks who are having problems with their previously very well-controlled chronic conditions because they're not moving. They're deconditioning. They're afraid to go out of their house to get a breath of fresh air. They're not moving their legs. They're becoming weak, and you know what they're doing? They're falling. When they fall multiple times, eventually they're going to break something. They're going to break a shoulder. They're going to break a hip. They're going to end up in that emergency room under stressful and situation that we do not want to see. So we do not want people sitting home, locked in their homes. We do not want them not contacting their doctors. We want everybody to be proactive. We want to see people moving around. We want to see them trying to maintain within social distancing, within a reasonable, common sense way, as much activity as possible, because it's going to prevent their blood sugars from going out of control, their blood pressures from going up. It's going to keep them from deconditioning. So we're concerned that folks, particularly elderly, when they hear stuff on television, they take that, they really internalize. And they are petrified, literally, to go into on their porch. They're petrified to go in their backyard. They're petrified that the air will cause them to get sick. And in the interim, they're basically becoming very unhealthy.
Okay, so I just want to follow up with your comments on the not wanting to bother anyone, so they're not reaching out. I mean, I'm going to go to Chief Burke because I'm thinking this because I had elderly parents and in-laws and stuff, and I remember this well. But at the same time, you don't want people waiting to that point, like you mentioned. You're looking at critical calls. So what, in prior to this, you'd get calls, and now you're getting critical calls. What was the difference? And you expect people to call you.
Right, and again, we get the don't bother. We didn't want to bother you guys, and we're available 24/7. I mean, and one of the things I'll also highlight is the pre-hospital abilities that the ambulances have. We have 5 ambulances in the town of Sandwich, 4 staffed to advanced life support, meaning we can do a 12-lead EKG in your house and determine cardiac damage and dysrhythmia on site in your house and start rendering treatment prior to even going to the hospital. And in the sequence of that treatment protocol, the hospital's notified, and we've had patients from chest pain to 47 minutes later at the cath lab having their occlusion opened up. Same thing goes for stroke patients too. We have a stroke scale capability where we will do some evaluation, and then there's a medication called TPA that can be given under strict guidelines that would open up any occlusions or clots. So we're definitely prepared, and the difference is people weren't afraid before. And I think hopefully we emphasize today, it's probably the cleanest the ER has ever been, ironically.
Right.
And so do not be afraid to call us.
So and Dr. Schneider mentioning as far as that protocol, as far as how, as far as what they're set up to respond to, and that people shouldn't be afraid to go there. At the same time, the people, your people, when they respond, are all in garb also, so they should expect,
I think you'll expect the masking of the analysis. The analogy we put to this was HIV. When that was an infection control and bloodborne, we started wearing gloves. That hasn't stopped. You will see masking and whether it's N95 or simple surgical masking for our personnel minimum through the next year. And I'm going to honestly say that's going to be part of our protocol. So don't be afraid if we come in masked up and gloved up. But the key is to call us. Because the criticality, again, that we are seeing is off the charts. And again, I just wanted to emphasize, people, don't wait. We can come and evaluate you in your house. Does not mean you buy you automatic transport. We can do some pretty invasive evaluations at the house under doctor's orders to see and to either put you at ease or say, hey, we need to take a trip to the hospital. This is what we feel is going on, and render the right treatments on the way.
Super, very good. And Dr. Schneider, as far as, with people out there, as far as, when there's potential, cases, what can family members do or friends when they see situations? What advice can they give to support people moving forward to seek medical help?
Right. So I'll tell you a personal story. About 8 years ago, I was at work and my mother-in-law called me. And I answered because it was my mother-in-law. And she said, I'm speaking funny and I'm weak. And I said, well, how long have you been speaking funny and been weak? Oh, about 2 to 3 hours. She had a major stroke. And I just looked at the wall and thought, I can't believe that she said 2 to 3 hours. And, she said, what should I do? I said, call 911. And unfortunately, she waited too long because she really wasn't 2 to 3 hours. That's the other thing I want to stress to people. People have a tremendous way of sort of fudging in their heads what's going on. They're in denial. They don't want to think about it. It's something else. And they kind of talk themselves into that it's okay. And she was really more like 3 to 4 hours, which is outside the window where you can treat a stroke acutely. So instead of having a situation that could have been extremely manageable, she has had permanent loss of function of the right side of her body. Has done well, but clearly it's a sad and tragic thing. So there's a perfect example of an elderly person who didn't want to bother anybody, didn't want to call. This is at like 9 o'clock in the morning, and unfortunately, had a bad outcome. So I guess what I would say that if you notice that the health of your elderly parents or neighbor or somebody is going downhill, intervene, push them to contact their primary care if it's not an acute situation. If 911 is necessary, call. Check in on people, ask questions. Even if you can't see them face to face, you can, and they don't have good technology, you can call. And you can drive by. I mean, that's the other thing. We can say, walk to the door, Nana. Let me see your face, So we can do things like that, and we should do things like that because, again, particularly the elderly, they have this amazing way of sort of, brushing aside things because they don't want to, bother anybody, and they're trying. I think they just, it's just the way they are. They're stoic people, and they don't mean, and they don't want to. They don't want to cause any trouble. My strong advice is to just keep an eye on them closely as you can.
Okay, thank you. Anything else you want to add, Chief Burke?
Nope, thank you.
I think as far as, thank you very much, Dr. Schneider, for coming today. The reason was, for this was Chief Burke and Chief Wack brought their concerns to the COVID team, and we felt, as far as they were seeing this uptick in calls of critical calls and not the usual calls they've received, so we felt it was necessary to reach out to the community and please, to ask you not to wait too long, to seek medical attention when you need to. Reach out to your physician. There's people here to help, but we don't want you putting things off and making it worse for yourself. So again, please do that. And as always, reminder that the governor's order for facial coverings is in place. Let's be considerate and be safe. Thank you.
Okay.
Thank
Oh, you're welcome.